Hey guys, this is going to be a quick episode. I'm going to review a recent story about a colonoscopy gone wrong. Patient was screaming and the doctor could not hear the screaming because he wasn't wearing his hearing aids. Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo. I'm a board-certified gastroenterologist with a medical practice in New York. However, today's case comes to us from Florida, where a doctor in Tampa was accused of performing a procedure on a patient while he was not wearing his hearing aids, and he couldn't hear the patient's screams during the colonoscopy. Or so Fox News would have us believe. So this story is going to be linked in the notes below, and you could peruse it if you'd like. But basically what happened is a 84-year-old an 84-year-old gastro doctor in Florida was apparently performing a colonoscopy on a patient who was not sedated during the procedure, or not deeply enough or properly sedated during the procedure. And the patient had some pain and apparently was screaming out, and the doctor could not hear what was going on because he wasn't wearing hearing aids. So the doctor is 84 years old and apparently needed hearing aids, which is not such an uncommon situation. But the unusual thing is that the patient was screaming during a colonoscopy and no one seemed to notice because the doctor lacked the sense of hearing at the time. Now, this may make sense when you're reading this in a news article. Maybe this kind of thing happens all the time. But if you do colonoscopy for a living, which I do, it is a kind of a ridiculous story. And I'd like to just give you my quick impressions of, when I read something like this, like what goes through my mind when I read a story like this in the news. So the story goes on to say that the doctor, who's 84 years old, began inserting the colonoscopy scope before the patient was fully sedated, and apparently the patient was yelling and screaming, and the doctor just persisted with the exam, not realizing what was going on because he wasn't wearing hearing aids. And surgical staff in the room also could not communicate with the doctor, according to the news report. So the medical board was contacted, and they found this was an issue, obviously, and the doctor's privileges were suspended to do colonoscopies for the time being. Now, what do I think about this? When I read a story like this, there's so many things. This just like screams to me that something is off with the whole situation. So as we know, and hopefully you guys know this already, or you've heard this in, just from living in the world, that colonoscopy is a excellent test to prevent colon cancer. You're supposed to do it at the age of 45. If you have no family history of cancer and no symptoms, you start doing colonoscopy at the age of 45 to prevent getting colon cancer. You remove these growths inside the colon called polyps. And if you have a polyp and you have it removed with a colonoscopy, then you should not go on to get cancer later in life. So it's a pretty cool test. And it's done with sedation, meaning you get some medicine and you go to sleep. You don't feel anything. You don't see anything. As the patient, you are asleep. You wake up when it's done, and it should be a 100% easy and comfortable procedure in good hands. Sometimes you may wake up and have a little gas or bloating or mild abdominal discomfort, but that's on the rare side of things. It should not happen often. And you definitely should not be screaming during a colonoscopy procedure, because you should be snoring or sleeping during a colonoscopy procedure. And that is how it normally goes. But apparently in Florida, if you're 84 years old and you forgot your hearing aids at home, it's a horror show in the endoscopy suite. So here are the thoughts going through my head. Why was nobody else in the room able to communicate with this doctor when his patient was screaming? The anesthesiologist, the nurse, the tech, everyone else seemed to be unable to communicate to the doctor that his patient was in fact screaming. Maybe they didn't have hands, or maybe they were texting, or maybe they were not paying attention. Or maybe this whole thing is a little sensational and ridiculous. But who knows? I wasn't there. This is not legal advice, but I'm just giving you my impressions of a story like this when I hear it. So in a real world scenario, there's other people in the room and you're having a colonoscopy. And if I was doing a procedure and I had blinders on, except for being able to see the screen, and I had earplugs in, and I couldn't feel the patient moving around, because when people get pain during a procedure, they move around. It's not like they just lay there and scream completely motionless. So other people in the room, even if all those things were happening, and I was doing this in like a VR world where I was just looking at the screen and had no tactile feedback and all my other senses were not working, there's other people in the room and they can see what's going on and they can say something like, "Hey doc," and if you can't hear them, they can move in front of your field of vision, or they can tap you on the shoulder and say, "The guy's not sedated, what are you doing?" So that's not like, none of this makes any sense to me. Perhaps the patient wasn't fully sedated right in the beginning of the procedure, and the doctor rushed the exam, and the patient said, "Hey, I'm not sedated," or "Ow." And I don't know how that's, that's not the right thing to do, but I don't see how that's like screaming during a procedure, but who knows? And the other thing is that maybe the guy was screaming and the doctor was totally oblivious, and there's a poor culture in that workplace and everyone's afraid of the guy. Maybe he's the boss man and everyone's afraid of him taking out his wrath if you correct him or interrupt him or say anything. So that's a possibility also. And again, I wasn't there. Who knows? Just guessing. But as a gastro doctor, I don't like when I see these things in the news and they give colonoscopy a bad name, because it's really a very valuable test. So why did the doctor start in the beginning before the patient was sedated properly? Normally, the anesthesiologist gives the anesthesia, and it's not like instant. It takes a few seconds to work. You usually wait a little bit before the patient is fully sedated and ready to go for the procedure. And there's certain ways you can check if someone's sedated. You can tap them on the shoulder. You can see if they're sleeping. You can say their name. When you start a colonoscopy, the doctor does a rectal exam to make sure there's no masses or any stool in the rectum or whatnot. So basically, during a rectal exam, you're inserting a finger into someone's rectum. You can kind of tell if they're sedated as the endoscopist, because people who are awake say, "Hey," and people who are not awake don't say anything because they're asleep. And their muscle tone is decreased when they're sedated. So you can tell, even if the patient couldn't say anything, that they are not asleep or they are asleep. It's pretty simple to tell. So maybe the doctor's rushing through the cases and the anesthesiologist just pushes the sedation, and then 5 seconds later, the guy's jamming the scope in there. That's a possibility. And maybe the patient said something and the doctor didn't stop, and the patient was angry, because I would be angry too. You got to wait the 30 seconds for the patient to go to sleep. Hold your horses. Like, what are you doing? That's the other thing. Maybe they were just rushing through everything. Maybe there's a poor communication between the doctor and the anesthesiologist. Maybe the doctor thought the patient was sedated and the anesthesiologist didn't say anything, and the doctor just jammed the scope in there. It's not the right thing to do, but could be prevented with just good communication. How's the patient looking? The patient's looking good. Am I good to go? Can I start? You're good to go. And then you do the rectal exam and you check. That's how we do it here. It's a simple 5-second discussion. It's common sense. You just tap the patient on the shoulder. "Hey, Mr. Jones, are you asleep?" And if they don't say anything, they're usually asleep. Then you do the rectal exam and you can find out right there. So the other thing is, screams. Like, who's screaming during a colonoscopy? I could see how if the guy was totally awake and the doctor's pushing as hard as he can, and, maybe he's a poor endoscopist and causing all kinds of problems. But there's many warning signs before someone screams. People, if they're starting to get light under sedation or uncomfortable, they make little movements with their body, and then their breathing picks up a little bit more, and their heart rate picks up. There's many signs before a patient's even conscious that they're starting to lighten up during anesthesia, and then the anesthesiologist typically will give a little more anesthesia, and the patient will go deeper, and you'll be good to go. And even if the patient's fully awake, there shouldn't be screaming involved, because you get tactile feedback from the scope. You're not just jamming the scope in there like you're throwing a javelin. It's a gentle finesse procedure, so you should really be not causing screaming, even the patient's totally awake. And I can see how if you have a loop in the scope and you're pushing, and you don't know what you're doing, and you're totally ignoring what's going on, how the patient could scream, because it obviously can cause lots of problems that way. But in good hands, there should be no screaming. And before screaming, there should be movement, and there should be a grunt, and there should be a moan, and there should be a verbal, like, "Hey, doc, what are you doing? I could feel this." There shouldn't be just screaming. That doesn't make a huge ton of sense. So who knows? But it shouldn't go with the idea that colonoscopy is a procedure where people are screaming left and right, because that would not be a accurate depiction of the procedure. So if you read the news article a little further, the plot thickens a little bit. They go into the fact that this doctor apparently was cited also for allowing an unlicensed surgical technician to perform key parts of the colonoscopy procedure. And in the article, they quote things like inserting the scope, manipulating the snare over the polyps, and other things like that. So that's maybe more of the bigger picture. Perhaps, who knows who reported the guy? I don't think it actually says in the article, but was it the patient or was it the staff perhaps was trying to get the guy out because he was not a good endoscopist, and maybe he was having the staff do things that they're not licensed for, and they were afraid to say it to him because they get fired, or who knows what the deal was. But at the end of the day, like, the doctor's the one who should have his or her hands on the scope doing the key parts of the procedure. And a technician during a colonoscopy is very helpful and actually necessary, because you need to take biopsies and all kinds of other things. So you really need like 3 hands on deck. It's the doctor's 2 hands, and the technician has their hand on the instrument as well. Technician usually has 2 hands, so that's good too, but you really just need 1 hand to operate the snare or the biopsy forceps, but you do need someone else's hand on the instrument, but not on the scope instrument, on the little attachments that go through the scope and the little accessories that go through the scope to remove polyps and cauterize things and whatnot. So it's really like a two-person job, but one person's really driving the ship and the other person's really just assisting on the command of the doctor who's doing the procedure. So the technician should not be turning the scope and holding the scope and moving the scope and manipulating the snare around a polyp. And it's really just like an open close, a little more, a little less, perfect. Okay, I'm going to cut through it. You're going to close. Like, it's a communication thing that you have with your assistant. It's not that the assistant just does stuff, because that's what the doctor does. So who knows? Maybe the whole operation was out of whack, and this is just a way to get this guy busted. The other scenario is that maybe someone's just trying to hurt this guy and reporting stuff that's fake. So you never know. This is why they have investigations. I'm not saying I was there. I have no idea who this doctor is. Maybe he's great. Or maybe he was great back in the day, just like a fighter pilot for, the Air Force. Like, maybe he was a stud a while ago and doing lots of colonoscopies and doing a great job, and now he's 84 years old and he has hearing aids, which is normal when you're 84 years old, and perhaps he's slowing down. He's not able to do these procedures with the accuracy that he used to. Like, would you throw him back up in the fighter jet and have him, shooting missiles? Like, no, probably not. At 84, he may be a little not be able to do that exact situation to the way he could when he was much younger. So maybe there's a time to retire from doing procedures. And I know that this is a thing with surgeons. At what age or at what point in your career do you stop operating? Do you stop doing procedures? And who knows? It's different for every doctor. I don't think there's an age cutoff, but there's definitely a time where you slow down, and it's probably in the patient's best interest that you stop doing procedures where you can cause harm. The other side of that coin is that at some point you should probably try to retire and enjoy a few years of life without having to go do colonoscopies, because really, I love doing colonoscopies. They're great. They're like the most fun part of the job. You get to go in there and use your hands and use your brain and find a polyp and take it out, and it's just kind of cool. But at some point I want to stop doing those. Like, when I'm 84, I hope that I'm retired and just hanging out. Maybe I'll be podcasting in a much deeper, much slower voice when I'm 84, but probably not. Hopefully I'll just be enjoying life. And there's not a ton of life left when you're 84 years old in terms of the years that you have in front of you, because most of your years are behind you. So perhaps it's time to put down the scope and maybe, enjoy things a little bit. And you don't have to deal with patients screaming during colonoscopies if you can't hear them. Now, a good doctor or a good practice should be doing all these things. They should be checking, are you sedated? They should be performing procedures in an optimal environment where everyone could hear and see things that are going on. There should not be staff that's afraid to speak out and say things because they're going to get fired or yelled at or a dirty look or whatever it is. And the operator, in this case the doctor on the colonoscopy, should be a proficient operator and should be doing their job to the best of their ability. And if they're not able to do that, they should hang up the scope and pick up something else. So that's the story here. I think the whole thing is probably sensationalized. There's probably other things going on here, or maybe it just was kind of a funny case that made it to the news. But at the end of the day, I don't like the fact that these kind of sensationalized stories perhaps turn people off from procedures that are very important. And with not everyone getting their colon cancer screening like they're supposed to, we covered this last week's episode, how 60 to 70% or so of people are getting their appropriate screening, and the rest of the country is not getting any screening. And there's blood tests and there's stool tests, and colonoscopy is still the gold standard best test to prevent colon cancer. But when you see a story like this and you see 4,000 comments on social media about a story like this, all saying that colonoscopy sucks, it kind of bothers me, because not enough people are being screened. People are still dying of cancer. There's 53,000 Americans that are slated to die of this disease this year alone. And we should be promoting screening more and not running sensational headlines about patients screaming during colonoscopy until we know the details. And if the guy was screaming, then that's too bad. It's a terrible story. And obviously the steps will be taken to remediate it. And it should never get to this point where you have a guy operating who's not capable of doing his job at that point. But that's Florida. What can I say? Anyway, thanks for listening. Hopefully this was an entertaining episode. And hopefully you like this brief and off-the-cuff kind of format, because it's definitely fun to record. If you like this, give us a follow. Give me a follow. Who's us? It's me. There's nobody else here. So give me a follow on social media at RealGIDoc. And you can also leave a comment or a rating on the show, which would help other people find the show. I'm realizing that people are finding the show now because I'm starting to get emails from all kinds of spammers about how they can produce my podcast for me. You know, the budget for this podcast is $0, so unfortunately, spammers, you're going to have to wait until I make it big, and then I have a budget, and then you can produce the podcast for me. But for now, I have to just do it myself. That's the story. Hopefully you got a chuckle out of this, and hopefully you realize that colonoscopy should not be a screaming procedure and should be more of a sleeping procedure. And it's easy, and really, that's the bottom line. Just get screened however you want to do it.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.